Laura.
Tracy. How are you?
Yeah, good, thank you. Welcome to everybody who's joining us. This is our next Insta Live with Laura Dinham from the Ozone Clinic. And today's quite a biggie in some ways because we're going to be talking about how ozone therapies can support those who are going through cancer treatments. And how ozone combats some of those side effects that a lot of people suffer from. So, Laura, could we start on that? Because this is, this is a really quite serious topic in terms for those particularly going through that. And we also know the stats are really high these days, which is pretty scary. I think something like one out of every two people by the time they're 65 would probably go through some form of cancer. So could you just sort of recap a bit, Laura, on what exactly ozone is and how that helps people get through their cancer treatments?
Okay, so ozone, as we know, is supercharged oxygen, 3 oxygen molecules. And it is not a stable molecule, so unlike oxygen itself, O2, which is a stable molecule and we breathe it in and it basically gets into our system, into our cells, and helps us produce energy. O3 is not a stable molecule, and when it gets into the body, it splits off into O2, which provides oxygen, and then it has this singular oxygen molecule, which is what does all the magic. And basically it really is great for anyone that is going through a cancer treatment, because it is really good at reducing the side effects of conventional therapies and improving those conventional therapies. So what it does is it improves oxygen utilization in the body, so it gets oxygen into those, really improves oxygen in the body and into the cells. We know that cancer doesn't like oxygen very much. It's what's called an anaerobic. It works anaerobically for the most part, and it's how it produces and replicates its cells. So when you put oxygen, it was found by a scientist called Otto Warburg that basically cancer doesn't like oxygen. So if we put oxygen in, it helps to reduce and stop the cancer from growing. So basically that's one element of it, but it also, this extra oxygen molecule splits off and produces something called an ozonide. And an ozonide, in technical terms, donates its electron to make new molecules that the body needs. Right. And this is individual, and the molecules can help support the immune system to basically modulate and help the immune system to kind of start to recognize that there's something wrong. It helps to reduce inflammation. It supports different pathways in the body, but it's really quite individual, because it's the pathways that you will need as an individual and what you potentially are lacking. So it basically provides the body with the commands, because it doesn't do the work. It just sends the messages by donating that electron to produce new molecules to tell the body what to do. And these commands can basically stimulate the stem cells and the mitochondria to repair in ill health. So it's not a standalone treatment, but it is a fantastic treatment and enhances and supports conventional treatment, because it's been shown to improve basically the efficacy, the effectiveness of chemotherapy and radiotherapy. And it has been shown in studies to improve this by 3 times.
Wow. I mean, that's quite incredible, because as we know, chemotherapy, radiotherapy, they do have an incredible success rate for those going through cancer treatments. But also, that radiotherapy and the chemotherapy do have the side effects are, because not only do they attack those cancerous cells, but they also attack your good cells, don't they? The healthy cells. Whereas what you're saying is
Yes.
having ozone treatment oxygenates and really kind of keeps your good cells fighting fit, if in a simple term.
Yeah, so it supports the good cells, and it really helps with detoxification because it can bind to the toxins and safely help them to be eliminated from the body. So it really significantly reduces the side effects of chemotherapy, which we have seen with our clients that have been able to work, that just feel well during their treatment, which is amazing.
Yeah, I would recommend. I mean, Laura's really had this very close to her heart because it was your sister, wasn't it, recently diagnosed with breast cancer, and Laura worked with her, you know, incredibly actually. And you can hear Laura's sister's story on our website. Jessica tells her story about, you know, having ozone therapies and how she really benefited while she was going through her cancer treatments, and it's a great story, so please do listen to that. So Laura, what significant improvements can someone expect if they have a combination of ozone treatments?
So they can basically they should reduce nausea, side effects through chemotherapy, feel well. They may feel a little bit tired, but that's kind of normal. Reduced neuropathies, reduced all the side effects really that are associated with chemotherapy that are, you know, we've seen them to be significantly reduced. People can really go through their normal day, work, and basically feel well during a treatment, which really is what you know everybody wants while the chemotherapy is doing its job, while the radiotherapy is doing its job. If you feel well, you can get on with your life.
Yeah. And also, I guess, you know, if it keeps you feeling well, then you're not almost dreading, are you, your next sort of bout of chemotherapy or radiotherapy, because, you know, that can't help either if you're feeling tense and worried and putting your body under stress, isn't it?
Yeah, no, absolutely. So it has, because then it has an all-round impact, because if you are feeling well, you'll be able to do those lifestyle changes that we also recommend, such as, you know, some exercise and walking and dietary changes. And when you're not feeling well, it makes it much harder for those to be done as well. So it impacts you as a whole to be able to do everything to support your body to get better.
Yeah. So Laura, could you just explain perhaps what an average ozone treatment plan might look like for someone going through cancer treatments?
So we would advise on the individual, but generally we would recommend 2 ozone saunas a week during chemotherapy treatment, and 1 IV ozone therapy treatment a week. And you can do either or. The IV therapy really has a massively increased beneficial effect as well, that can help to prevent the cancer growing, and the ozone saunas really help with detoxification, so eliminations of toxins to really reduce the side effects, and obviously both treatments get ozone and oxygen into the body, which we know doesn't like, and both treatments will help to improve all the other conventional treatments that someone might be having, and we can also also do insufflation, so we can administer the ozone through the vagina or the rectum, which if people are unable to take intravenous because their veins are not stable, which is quite common during chemotherapy and conventional treatments, we can administer it that way, which is taken up systemically and really has also huge benefits and good results.
Actually, while we're on that subject, I just wondered, would you mind just explaining what insufflation is? Because I'm sure those people who don't understand it might think, oh, that sounds a bit scary. Especially when you say rectal or vaginal, people will be like, oh.
It's really quite gentle and simple. We literally take a catheter and we attach it to the ozone machine, and then it's inserted either into the vagina or the rectum, and then we slowly infuse ozone into those areas, 10 millilitres or 25 millilitres at a time over a 10, 15, 20-minute period. We gradually build this up to about 400 or 500 millilitres, and it's very gentle. You will just feel, it's not an uncomfortable feeling. It's it basically is one of the more comfortable treatments. Just a little bit, you know, in an area that is maybe a bit more sensitive for people.
Yeah. And I'd like to add that those insuffations are normally done while you're in the pod, isn't it?
No,
oh, right, okay.
Not. No, yes, we can do vaginal insufflation within the ozone sauna, so that can be done together. But we can also do it as a standalone, right. And rectal is not done in the pod, it's done as a standalone.
Okay, thank you for explaining that. So please, everyone out there, it sounds a bit scary, but actually it's not a scary. And as Laura said, it's quite a gentle thing. It's not painful in any way, but it does have incredible results. So yeah, and I think that's a really interesting point that you make, that a lot of people that are already suffering from cancer, but then going through cancer treatments, you know, your body is really trying very hard to stay healthy, but it is obviously, you know, it is struggling. So things like your veins might not just be great for doing the 10-pass machine and things like that, but obviously the saunas, insufflation, that's all great.
Yeah.
So I was going to ask you a bit more on preventative. Would you just tell us a little bit, because I'm sure people are thinking, you know, sorry, I'm mixing up my words here, but what I was trying to get at is that actually if you maintain your health, particularly using ozone and oxygenating the blood and oxygenating the body and energizing every single one of those 50 trillion cells that we have, it can act, I guess, as a prevention as well for people perhaps getting cancers.
I mean, we know that the cell changes are happening because of the way we live. Our immune systems are struggling because we are bombarding it with toxicity that really the body can't cope with, because we are now seeing just huge amounts of chemicals in our everyday life that we can't really avoid, and if the body can't cope with them, it creates inflammation, it creates backup, the cells can't work properly, and the immune system gets triggered. And then when they're faced with pathogens or viruses, they're unable to deal with them as well as they should be able to deal with them. We're also then faced with huge amounts of increases in stress, which affects our nervous system and also shuts our immune system down and our gut system down, because we are living in a very sympathetic fight or flight fight or flight and freeze kind of lifestyle these days, which also dampens down the immune system. So all of these things really promote ill health and promote chronic conditions because the body is unable to function in the normal way. So as a preventative tool, basically when this happens, oxygen utilization within the cell decreases, and that happens as we age, but it also happens with the toxicity, the reduction in immune function, and ozone really helps to improve oxygen utilization. And when the oxygen utilization is improved, the cell can work more efficiently, it can get the nutrients in and the waste out more efficiently and effectively, and it produces more energy. So when this happens, then we are living in a much healthier way. We're able to get rid of our toxins, the toxic load, where our immune systems work better. We also combine this with nervous system support so that we can down-regulate the nervous system and into the parasympathetic rest and digest. And so it's a combination of everything, but as a preventative health measure, I would say from a personal point of view that it's essential in today's world.
Yeah, well, thank you very much for that. I think that is such a relevant piece of information, and I really hope lots of people take that on board. For those people that haven't been able to tune in today, we are on YouTube. You can go onto our website at theozoneclinic.co.uk, and you can please sign up to our newsletter, which goes out. We don't bombard you, it goes out every other month. We've got our third one out that's just gone live today, so there's a chance to sign up to that. And you know, we do talk about these things, and we talk a lot about them. We run a blog and things like that. But I think today, Laura, I just think what you've said today is will resonate with so many people. And just one other stat for anyone listening out there. I think, the research shows that of everyone getting cancer or that will get cancer, only 10% is normally shown as being genetic. So please listen to what Laura has to say about toxins and our toxic overload. It's really, really important. So Laura, is there any other little bit of information that you feel will be really beneficial, or anything you want to recap on about those and ozone supporting cancer, those going through cancer treatments?
The main point I would say is that ozone itself is not a standalone treatment, it's a supportive treatment, and that's why we also recommend that you come to us for diet, lifestyle, supplementary, the whole body. We look at the whole body and how you personally need to support yourself to get better.
Yeah, and it does work, and it really does work. So
I mean, we see the results. We see people that are they have better outcomes with their conventional therapy. They feel well, and basically it really just provides the best outcome for the individual.
Yeah. And anyway, that's been brilliant. Thank you so much, Laura. Number 5 done. And yes, we'd love you if you could all tune in a couple of weeks' time. We'll be doing another one, and we're going to talk a lot about sports injuries and how you can look after yourself and how ozone really works for sports men and women, if you're an amateur or a professional. But I think today's is just been a really important message. So thank you again, Laura, and we'll speak soon.
Okay, bye-bye.
Bye.